So before I get too started, I want to ask you, I'm going to show you some images here. And I want you to take a look at these images, specifically through health, okay? A lot of you are planners, engineers, design, whatever the industry you're in. If these types of things came across your desk, right, and you had to act on it, or you had to give a recommendation to a council or planning and zoning or what have you, what would you say about some of these images in terms of how healthy they make your city or town? So with some of those unfortunately are fairly common, right? That parking lot one is a great one. Having served in the military, I actually still utilize the VA. Sometimes you see these huge parking lots in a hospital, for example. Man, there wasn't a shade tree to be had, right? There wasn't even sidewalk, nothing. It was just, have at it, good luck, don't get run over. So maybe that's the type of thing where you look at it and say, boy, how can we just tweak this a little bit to make it a better situation? This example, I love this one. We talk a lot about connectivity and that sort of thing. In the last few years, we've definitely started to see more in terms of pedestrian connections, but maybe not as street connections. Okay, kind of a middle ground there. Well, this one, someone took the time to think about this development, and they said, well, let's put this trail through here. That's a good idea. Only nothing connects to it. So you got to walk all the way over here to use this trail to come back. So maybe that's the kind of thing when you see that in a land use application, you can make some of the tweaks based on what you think about in terms of public health. Again, probably with just a few tweaks here and there and some suggestions, we're improving our built environment and making it a little healthier. That is kind of the idea of what health impact assessments are trying to accomplish. Okay, so some of the steps on how this is carried out. The first couple are pretty similar to the EIS process. Is a project or policy right? That's what the screening process is about. Scoping, we're going to come up with the parameters in terms of temporal and geographic to do the analysis. Going through the assessment, actual assessment, and then the report and monitoring. So what is some of the information that we can use? Certainly the census is all brand new. Good information there to be had in terms of your demographics. Department of Education, BRFEs, that's my favorite government acronym now. This is an example from Highway 99, which is down by Vancouver, Washington. This specific language that came out of an actual HIA. It's pretty generic, a little broad. Improve access to parks, typical things that we might expect. This was, I think, also a rapid HIA. So again, it's more the qualitative type of analysis. Gives you an idea of where a lot of these HIAs have been done. Okay, there's a bunch of grants on the street right now for HIAs, and this number is going to increase by, I would say, at least half, maybe even double in the next few years. Lots of them will start to be done.